and co-workers, and they're worried about their own health. That is entirely understandable under these circumstances. I want to assure every resident of this great state that your team, Team South Carolina, in all of its capacities, is engaged in working to get us through this crisis. And we will get through this. And we will get through it by using our heads, by being smart, by being deliberate, by staying calm, and by using common sense, and always by working together and demonstrating courtesy and compassion towards each other. Today, we have taken the best course of action for our state, for our people, and for our future. Let us remember that we as South Carolinians are resilient. I have faith in every South Carolinian. We are known around the world as friendly, hardworking, and honest people, a reputation well deserved. As our daily lives are impacted and disrupted by this coronavirus, let us all remember that and be proud of South Carolina. Dr. Bell, Linda Bell.
Thank you, Governor. Good afternoon. South Carolina, along with more than 36 states, is now reporting positive cases of a novel coronavirus named COVID-19. This is part of an expanding outbreak worldwide of a respiratory illness that began in December 2019 in Wuhan City, Hubei Province, China. As an update, DHEC is investigating one new possible case of COVID-19 novel coronavirus from Camden in Kershaw County. The one new case is a female in Camden who had contact with a known case. She was evaluated at a healthcare facility and is currently isolated at home. DHEC received her positive result from a private lab late yesterday, March 12th. To date, DHEC's public health laboratory has conducted 123 tests, 13 are positive, and 110 are negative. We have learned that the latest cases in Kershaw and Lancaster counties do also have links. We are continuing to investigate and will update the public as other new information is known. Our top priorities remain preventing the spread of the disease and protecting the public health. This includes working to control spread and measures that best protect all individuals. We know that many residents are concerned about what impact this virus may have on future operations of many of our institutions, including our schools. The CDC has provided guidance to help determine a course of action based on specific circumstances of disease activity for each community. We are monitoring the status of the virus in South Carolina to make informed decisions about large gatherings. We have no evidence that the cancellation of schools and events outside of Lancaster and Kershaw counties is needed at this time. We are constantly monitoring our epidemiologic data and following CDC recommendations for strategies to slow the spread of disease in our communities. We've been receiving a lot of questions concerning schools and other larger gatherings. I want to emphasize school closures and the cancellation of larger gatherings and events from church services to festivals should not be taken lightly. Waiting to make decisions until the correct time, combined with other social distancing interventions, including staying home when you are sick, is an effective approach to limiting spread despite potential disruption. Other states are also beginning to practice social distancing. What we're doing in South Carolina is based on what's happening in our communities now. We do not have widespread transmission in the state at this time. In Kershaw and Lancaster counties, where we've seen person-to-person transmission, those cases had close contact that occurred through either household or other close contacts, and we continue to monitor the ongoing situation. This includes making precautions for our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. While the CDC has stated that we will see widespread transmission in the United States, the majority of cases will have mild illness. Although we are not currently seeing widespread transmission in South Carolina, we expect to see more cases, and we will continue to monitor CDC guidance and recommendations. As part of this effort, we are preparing for transition from containment to mitigation. The goal of containment is to identify individual cases of illness and stop the chain of transmission from individuals when possible. As cases increase, the goal of mitigation is to increase the practices of social distancing, to help slow the spread but not stop it, and to assist healthcare systems in continuing to provide care and to more slowly absorb the cases that are being reported, particularly to provide care for those who need it most. At this time, it is recommended for the majority of South Carolinians to continue their daily routines with a focus on protecting against illness by practicing good hygiene, including routinely washing your hands and covering your mouth when you cough. Again, each of us can do our part to protect those who are at risk of more severe disease, and it's all of our responsibilities to help prevent the spread of illness. Individuals with signs of illness are asked to take seriously the recommendation to stay home from school and work and not attend public gatherings. Reach out to your healthcare provider if you are showing signs or symptoms of illness such as fever, cough, and shortness of breath. If in the future our medical experts and epidemiologists feel a change to this recommendation is needed based on our surveillance data and disease investigation activities, we will immediately notify the public. We are still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you, and I'm happy to take any questions.
Dr. Bell, when you get tested right now, is there a certain criteria of even if people tested that they believe they have symptoms of COVID-19?
Yes, there are specific criteria for the symptoms of fever, cough, shortness of breath. Also taken into consideration is a possible history of any contact where disease transmission is known, and if there's no other explanation for the illness.
Doctor, with that said, we've had a number of viewers call our TV station saying, hey, I believe I have some of these symptoms. I actually went to my doctor. I could not be tested for the coronavirus. They're frustrated by saying they are having to jump through hoops to get tested to see if they have this.
And we're glad to report that testing is now more widely available through reference labs. And previously, DHEC was required to have all individuals meet the CDC criteria and approve testing through our DHEC lab. But at this time, DHEC will no longer have to approve testing. We'll leave it up to the discretion of individual healthcare providers to make a recommendation for who should be tested.
Follow up on something you said a moment ago. You said other than Kershaw and Lancaster counties, there's basically no need to cancel events or public schools to shut down. We've already had cancellations in Columbia, Lexington, and other areas of the Midlands. What's changed in the past 24 hours?
Well, DHEC is providing information about disease transmission, disease activity in those counties, and other than what we have previously reported with the positive cases, nothing has changed. So we are providing the information for individual entities, organizations, event planners to make their decision about social distancing and about large public gatherings.
President Trump mentioned not long ago about the national emergency that there would be some drive-up options for testing around the country. Could we be seeing any of that here in South Carolina?
There are arrangements being made in South Carolina for drive-up testing through some health systems, but the drive-up testing is a support function to telemedicine. So individuals must first be evaluated by a healthcare provider through telemedicine, and if they meet the criteria for testing, then they can be tested through one of these drive-through opportunities. If they have not been previously evaluated by telemedicine, then they will be turned away.
As these
Yes,
tests
ma'am.
become more widely available, can you post
sorry.
online where they can get tests? Because people are saying they've been told even by their doctors you can only go to emergency rooms, but they don't want to infect people in emergency rooms.
DHEC has provided a health alert to provide information about where testing is available, the recommendations for testing, and because testing is now more widely available and because the demand for testing has increased, just in the last 24 hours, we will actually be issuing another health alert that will provide updated information about testing guidance where testing is available.
And it-
Let's
A
continue with
senator
that.
said publicly yesterday from the podium that these test results take 48 hours to get back. Is that the case? And is perhaps, or is something being done to speed up that result time?
It depends on the lab that the provider uses. The turnaround time varies from one lab to another. It varies anywhere from about 24 to 48 hours in our DHEC lab, and these private reference labs are reporting that they can turn around a test in 3 to 4 days, and that is from the time that they receive the specimen.
Yes, ma'am.
Thank you. Can you give some more specifics on how these standards will be lowered so that people can get tested? Less than 130 tests still seems like a very low number here in South Carolina. So what does that mean as far as specifics or standards of going and getting tested?
Well, one thing is that we don't see evidence of widespread activity in South Carolina. So because the test is indicated for those who are ill with symptoms consistent with it, that means that that number of people are meeting the criteria. What I'm explaining, we're not lowering the standards, is that we are no longer requiring for a DHEC medical consultant to approve the testing. So a healthcare provider, if at their discretion, make the decision independently that the individual meets the criteria, the DHEC medical consultant does not have to approve the testing through the DHEC lab. Healthcare providers can also use these other reference labs that are now available.
After a person has been tested positive for the coronavirus and has been quarantined for about 2 weeks and a 14-day period, afterwards, what is the next step for that individual to take?
So individuals who have been diagnosed are asked to self-isolate until their symptoms have resolved. The monitoring period applies to the close contacts of individuals who are not ill, and they're asked to restrict their activities to make sure that they don't develop signs or symptoms of illness within 14 days after contact.
Officials in other states have estimated that there are actually a lot more people sick and actually given numbers of those estimates than the people that have tested so far. Do we have any sort of estimates like that in the state?
Repeat the question, please.
So officials in other states have said that, for example, while we only have X number of cases confirmed, we estimate thousands, perhaps 10,000 more actually have it in the state. Do we have any sort of estimate for how many might have it beyond those confirmed?
No, we don't have an estimate of how many more might have it, but as we're monitoring for signs and symptoms of illness and providers are aware of what to look for, and we're testing those individuals who meet those criteria, we don't expect to find every person who's diagnosed, particularly if cases begin to increase, but at this time, as we're evaluating those with symptoms of illness and we're testing, the proportion of positives also tells us that if we have a fair number of negatives, that's an indication that the screening that we're doing is reasonable because we are detecting a fair number of negative individuals. And also, as we compare ourselves to other states, be reminded that our population is quite different from these other states.
Will individuals who have tested positive for the coronavirus and no longer have symptoms after that 14-day period, will they be retested?
No.
I know with a lot
Yes,
of
sir.
hospitals in the state, like MUSC, Prisma Health, they're doing these tests, these virtual tests. Have those had any correlation at all to any positive results?
A virtual test?
Like the way that MUSC goes about the free virtual care screening. Has that led to anything, any positive case, any correlations at all?
The telemedicine involves the opportunity to visit with a healthcare provider remotely through a television screen, basically. And that assessment.
All right, we've been
includes-
listening in here on this press conference in the West Columbia area. South Carolina Governor Henry McMaster has just declared a state of emergency for South Carolina, and we also saw other top health officials and folks responding here to the coronavirus concerns there in the state, addressing a couple things. We're seeing closures of Lancaster and Kershaw County schools for 2 weeks, and we're also seeing some new information. This new possible case that was reported out of Camden, which we've reported throughout the week, has been pinpointed as an area where they are seeing community spread. This new case was apparently a female contact with a previously known case, and so that new case here is being isolated at home. We're also learning 123 coronavirus tests have been issued, 13 have come back positive, but reiteration here from health officials there in South Carolina that there is no widespread transmission. These current cases that they've been monitoring were apparently all in close contact, household contact, they say in some cases too, and so they are telling folks for the general public, in general, we're looking at continuing daily routines, just practice social distancing and good hygiene. Bill?
Yeah, one of the bigger developments this afternoon is CMS here in the Charlotte-Mecklenburg area. CMS is holding an emergency board meeting tonight. So parents, you're going to want to stay tuned to the news to see what becomes of this meeting. Again, CMS is holding an emergency board meeting tonight. We'll have a reporter there covering that. Please check in with our social channels and certainly on air for the latest developments with that.
All right. We're going to be here for you. We're going to be gathering all the latest information, and we thank you for staying with us. We're going to take a quick break, and we'll be right back.
When you want to get more, then it must be a Honda. Don't settle.